morning, I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. है ना, तो fetal medicine की premise यही होती है कि we just want to sort of screen the baby and to look around for the baby so as to see that is everything fine with the baby, right? But many a times what we identified is this, that whatever congenital abnormality that we identify, so meaning thereby that we demonstrate and we expect and we anticipate, and then again we demonstrate that all those congenital abnormalities that we have identified early in the gestational age gets corrected or resolved. Okay, so the ventricular septal defect is one of the one of the most common congenital heart defects in which we identify that it is a muscular VSD. So in 95% of the cases what we identify कि वो resolve हो जाती है and then it gets resolved spontaneously as we move on further. Right, so many times at level 1 at 12 weeks and 13 weeks, whenever we are doing the ultrasound, we demonstrate that probably it is a muscular VSD, but meaning thereby that we usually counsel in the same manner that in 95% of the cases it usually happens that it resolves over the period of time, and then probably this is one case in which we identified some congenital abnormality at 12 weeks, and in a follow-up scan at 16 weeks we identified that they've resolved. Right, so similarly on these lines we also counsel them that probably be in a follow-up and all these things should settle down on their own. Right, this is a scan we are seeing at 12 weeks and then we can identify it is a muscular VSD, right? Okay, so this is the point is here, and then we identify that this could be a sort of a muscular VSD, even though we can identify the tricuspid and the mitral pulmonary veins and all those stuff, but this is a muscular VSD. So what we have told them is this, that 95% is a chance that probably it is a very good amount of a chance to 95% that should resolve on its own at 16 weeks. So the lady had come back again at a follow-up, and then this is the scan. So this is lateral four-chamber view, and then so this is also we can see the septum secundum very nicely is this, and then the complete interventricular septum, and then that muscular VSD that we were demonstrating has resolved, right? Neural tube defects and the congenital cardiac defects. Out of those congenital cardiac defects, the muscular VSDs, these are one of the commonest sort of congenital abnormalities that we usually pick them up at something around 12 weeks, and out of those muscular VSDs, most of them, as a matter of fact 95% of them, they usually resolve spontaneously in the antenatal period, and probably we would try to look around, and then we'll try to follow it out across, and then we'll try to follow them and demonstrate that it has resolved, and therefore there is hardly anything to get worried of, right? So this is how what we want to tell is this, that there are a lot of other conditions also, so probably I'll demonstrate, but then this was a one good case in which we identified that this was a muscular VSD and has got resolved at something around 17 weeks. So it is very, very reassuring, right? Thank you very much for your patient listening.